Hi, my name is Santos Escobar. I am from the Catholic University, and I will talk about the case of a patient with laryngeal papillomatosis. The definition: the laryngeal papillomatosis, also known as recurrent respiratory papillomatosis, is a real medical condition, and the laryngeal papillomatosis causes a tumor or a papillomas to develop over a period. Without treatment is potentially fatal as wound contour grows and could obstruct the airway. It is transmitted through the oral sex and is not considered a sexual transmitted disease. The symptoms of the laryngeal papillomatosis are uncertainty or strain of the breathing voice, the size and the pacing of the tumor dictate the change in the person's voice and have a breathing difficulties.
Human papillomaviruses, HPV, are common viruses that can cause warts. There are more than 100 types of HPV. Most are harmless, but about 30 types put you at risk for cancer. These types affect the genitals and you get them through sexual contact with an infected partner. They can be either low risk or high risk. Low risk HPV can cause genital warts. High-risk HPV can lead to cancers of the cervix, vulva, vagina, and anus in women. In men, it can lead to cancers of the anus and penis. Although some people develop genital warts from HPV infection, others have no symptoms. Your healthcare provider can treat or remove the warts. In women, Pap tests can detect changes in the cervix that might lead to cancer. Both Pap and HPV tests are types of cervical cancer screening. Correct usage of latex condoms greatly reduces, but does not eliminate, the risk of catching or spreading HPV. Vaccines can protect against several types of HPV, including some that can cause cancer.
The application in medicine. The patient of 65 years is a male that presents a laryngeal papillomatosis. The diagnosis is a malignant tumor in the larynx, and with a laryngoscopy, they found a cystic mass that stayed obstructing the glottic space. The tumor was detected on August 11 of 2016 in the Hospital of the Specialty of the Armed Forces.
Module 2. Human papillomavirus replication and cell cycle dysfunction. Over 100 HPV types have been characterized by molecular techniques, and about 40 types are able to infect the genital tract. Microtrauma to the squamous epithelium of the cervical transformation zone allows HPV to come into contact with the basal cell layer, where it attaches to the basal cells. The HPV genome is released into the cell and transported into the nucleus for transcription and replication, where it initially remains non-integrated as an extrachromosomal, episomal element. During normal basal cell division, 2 daughter cells are produced. One of these remains in the basal layer. The other begins its journey towards the epithelial surface, undergoing differentiation as it moves. When they reach the upper layers of the cervical epithelium, the HPV genomes are packaged into infectious virions, which are lost from the surface during the normal process of desquamation. In daughter cells infected with oncogenic HPV types, of which the classic type is type 16, HPV DNA is integrated into the host cell genome, resulting in increased expression of the viral proteins E6 and E7. These interact with cellular proteins to induce proliferation and eventually immortalization and neoplastic transformation of the infected cells.
The plan. The patient's treatment is a chemotherapy with a cisplatin and radiotherapy followed. The traditional surgery and the carbon dioxide laser surgery and not those removal of the prosthesis or form of the treatments for the labyrinth papillomatosis. These carbon dioxide lasers normal removal is the most common removal method. The carbon dioxide laser must be used precisely to prevent the scarring of fibrosis and lamellar graft malformations. Many antiviral drugs like the cidofovir has been used to the treatment of the labyrinth papillomatosis, but it is not completely stop the tumor for growth.
Treatment of papilloma is generally surgical. Take the patient to the operating room. And perform a direct laryngoscopy, inspecting the entire larynx, and a bronchoscopy, which is looking down the trachea to make sure that there's no spread of the papilloma. Down into the with airways. Important to know is that the papilloma is just on the surface. It grows just on the skin, so we only remove just the
because the treatment of chemotherapy and the radiotherapy is has not been a reducing the depth of the malignant in the larynx, and the patients do a tracheotomy was performed so they can be prepared because these tumors cover the area.
Papilloma is due to the human papillomavirus. There is a very small risk of cancer in laryngeal or recurrent respiratory papillomatosis, as we call it. The diagnosis is made often by inspection, looking with the laryngoscope, flexible laryngoscope in your nose, where you have a good idea based on its look that it's papilloma. But it always has to be confirmed.
The conclusion the patient that present the laryngeal papillomatosis skip drug therapy and the tumors no give out. Thank you. Hi, my name is Escobar. I'm from the Catholic University, and I will talk about a phase of the trial of the severe phase alpha in the lysosomal acylase deficit. First, the definition. A lysosomal acylase is an essential lipid metabolite enzyme that breaks down on the endocytosis lipid particles and regulates the lipid metabolism. We conduct a phase 3 trial of the enzyme replacement therapy in children and adults with lysosomal acylase deficit, and under appraise the case of perseveration and severe dyslipidemia.
Yeah, so recently there's been a lot of discussion about a new condition. It's actually an old condition that we've kind of resurfaced. It's called LAL deficiency, or lysosomal acid lipase deficiency. So what is it? It's a condition in which the liver can't process cholesterol esters correctly. So either because of the food that we ingest that has cholesterol, or as a consequence of the body recycling cholesterol, it comes back to the liver as cholesterol esters. Those esters have to be broken down into free cholesterol for the body to use it once again. And therein lies the problem. They don't have a digestive enzyme within those lysosomes in order to do so. As a consequence, two things happen. One is the cholesterol levels will go up. Again, in most of our experiences, that looks like it might be familial hypercholesterolemia, so our inclination is to treat these with standard drug therapy, including statins. The problem is that cholesterol ester is trapped inside lysosomes, and those lysosomes reside in the liver. And as a consequence of all this cholesterol ester, that cholesterol ester is going to cause damage to the liver, and ultimately it's going to cause scarring or cirrhosis. So these people get into serious trouble with liver failure. Interesting enough, the therapy that we offer to lower cholesterol, statins, may actually make that condition worse, because what they do is upregulate the LDL receptor, cause more cholesterol esters to be incorporated into the liver, but they can't go anywhere. They don't have an enzyme to digest it. So there's new and promising therapies on the horizon. We hope that that'll be FDA approved sometime in the near future and it'll be safe and effective. But it basically is replacing the enzyme that's deficient. And as a consequence of that, hopefully the liver function studies will normalize. Short-term studies up to a year, we've seen dramatic improvements in liver function studies as well as the cholesterol level. So stay tuned. I think lysosomal acid lipase deficiency may be something on everybody's horizon here in the near future.
The evolution remains. In this user-center randomized with double-blind, the placebo-controlled study involving 66 patients with evaluated safety and the efficacy of the enzyme replacement therapy CBPase alpha. The placebo-controlled phase of the study was in 20 weeks long as followed by open-label treatment for all the patients. The primary endpoint was normalization of the animal's aminotransferase levels. The secondary endpoints included the additional disease-related efficacy assessment, safety, and side effect profile.
My name is Mark Goldberg. I'm the Executive Vice President for Medical and Regulatory Strategy at Synergiva Biopharma. We're studying lysosomal acid lipase deficiency, which is an autosomal recessive disease due to mutations in both alleles of the gene that encodes lysosomal acid lipase. This enzyme is critical in cholesterol metabolism. When an LDL particle binds to the LDL receptor and gets taken up by the cell, the cholesterol esters and the triglycerides within the particle are hydrolyzed within the lysosome into free cholesterol and free fatty acids. And when this enzyme is deficient or absent, there's a dramatic increase in the amount of lipids that accumulate in the lysosomes of the cells throughout the body, but particularly in cells of monocyte macrophage lineage and hepatocytes. This leads to progressive accumulation of fat and steatosis in the liver, usually a microvesicular steatosis, so that progresses to fibrosis and cirrhosis. And
Correct. A total of the 65 of the 66 patients who underwent the randomizations completely the double-blind portion of the trial and continued with the open-label treatment. At the 20 weeks, the alanine aminotransferase level was normal in the level of 36 patients with a severe case alpha group and 2 of 30 in the placebo group, with mean change from the baseline of the 58 units per liter.
The most difficult part of that year was just not knowing. The stress of test after test and just not knowing what was wrong with him. We did a liver biopsy, and that's when we found out he had stage 2 scarring on his liver already at 5 years old. The day we found out Tristan had this, it was a whirlwind of emotions. I was devastated, my little guy has a problem, what can I do to help Tristan? It was just, if I could change places with him, I would do it in a heartbeat so he wouldn't have to go through it. To find out that there was a trial to help him, it made everything better. It just kind of helped us cope with it. We just told the doctor we just want to do it. Whatever we can do to help him get better, we want to be a part of it. Since Tristan's been in the clinical trial, his lab results are great. Life like today with Tristan is like any other day. He's a normal 9-year-old kid who just wants to run and play. And he really doesn't let it hold him back. He just goes and plays, and he lets everybody know what's wrong so they know to take it easy on certain things. But other than that, he doesn't let it affect his life. For Tristan, in the future, I hope he continues on with help raising awareness and helping other people with the disease.
The computer requires the effective case secondary episode and endpoints, predictor improvement in the lipid levels, and reductions in the pedophile count. The number of the patients with adverse events were similar in the two groups. Most events were male, were considered by the investigator to be irrelevant to the treatment.
We've got two presentations on a poster at the meeting. The first presentation is the results from a phase 3 study, which is a double-blind placebo-controlled study in both children and adults with lysosomal acid lipase deficiency. The second presentation is a phase 2-3 study in infants with the most rapidly progressive form of the disease, which is typically lethal in the first 6 months of life. And then we have a poster which describes 2-year follow-up data on adults that were put into the first human study with Kanuma, and that's taken through to 2 years of treatment.
The conclusion, the severely place alpha therapy result in a reduction in the multiple disease-related diabetes, hepatic, and lipid abnormalities in children and adults with lysosomal acid lipase.
Assistant Professor of Pathology at the University of Utah. I am also Medical Director at ERUP Laboratories, ensure the responsibility for the Biochemical Genetics Lab. Today I would like to discuss a rare and possibly under-recognized cause of liver deficiency is an autosomal recessive disorder characterized by the accumulation of characterized by the accumulation of cholesterol esters and triglycerides.